Department reported 580 new cases, bringing the country's total close to 23,000 infections. So are Metro Manila and other areas ready to shift to more relaxed quarantine rules? We hear more from infectious disease expert Dr. Benjamin Ko, joining us on The Final Word. Dr. Ko, thank you so much for joining us. With the numbers that were stated today, are we winning this battle or close to winning the battle against this COVID-19 enemy?
Well, since the Department of Health has divided the cases now into fresh and late cases, the late cases are actually the backlogs that they've been battling with for quite some time. But if you look at the total number of fresh cases that we've had lately, for the past 2-3 days, we've been reporting more fresh cases, which means that we've been catching up with the backlog. And among the fresh cases that we've seen less in the National Capital Region compared to Region 7 and the other regions that are not mentioned in the list.
So if you're saying,
yes, Doctor,
so if you're saying that we're doing quite well here at the National Capital Region, are we likely to see then a transition on the 16th from general community quarantine to a modified community quarantine for Metro Manila?
I think that will be up to the IATF to decide. But definitely, it's not something that you would go back to a modified ECQ. So it's either you extend the GCQ another 15 days or you step into a modified GCQ. But the numbers are really much lower in Metro Manila, in the National Capital Region for that matter. Over the last week alone, last 7 days, we've been marking at around 70 to 100 cases per day, which is really much lower than the 289 cases the week before and the 250 cases the week before that.
So the numbers are looking very encouraging for Metro Manila, and we are seeing that the government and the local governments and the private sector are continuing this fight against this health crisis, Dr. Ko. But what do you think is still missing?
Well, we still need a lot of work in contact tracing. As a matter of fact, for some of the facilities, the turnaround time has to improve, which means that we need to get the results back within at least 48 hours. It's very important, and I cannot overemphasize that the turnaround times of PCR tests return very quickly because especially for getting mild cases and asymptomatic cases now, you'd like to identify the contacts as early as possible. Losing them out in the next 10 to 15 days makes no use, makes it useless for doing contact tracing at that point.
But doctor, we're already 3 months into these community quarantines. Why haven't we gotten this contact tracing issue into a science?
I think it's kind of difficult to do the contact tracing, particularly on the barangay level. I mean, trying to look at, there are a couple of explanations to that, including the fact that when the results come back, especially for patients that are asymptomatic and with mild symptoms, by the time that some of the results even get back, let's say 7 days or 10 days, some of the patients may have recovered and cannot be found within a certain community already. So it's really an extra effort for the Department of Health to do more contact tracing for the community, particularly those in the informal settler communities.
Apart from contact tracing, Dr. Ko, are we also having issues with testing? Because the government said we should be reaching 30,000 tests per day by the end of May, but we're still not there.
The government says that we need to do at least, they want to do 30,000 tests by the end of May. But if you look at the data that we have, we're picking up already at least, we only have at least 7% positivity rate, which is very good, The WHO puts a positivity rate of 10% and below. When you say that you have 10% and below positivity rate, that means that you're testing enough. So that means that we're at the 10,000, we average 10,000 a day already. That's good enough. Increasing it to 30,000 is actually a challenge, but if it can be done, it must make sure that the turnaround time of all of the tests that return for doing 30,000 or even 50,000 a day should be within a 48-hour period.
And Dr. President Duterte has always said, no vaccine, no face-to-face classes. Where are we right now in finding a COVID-19 vaccine? Will it be coming from China? Will it be coming from the US, Europe? Where will it be coming from?
There are over 100 companies that are trying to develop a vaccine, but a vaccine that's going to be developed is challenging. I mean, it's not something that's an overnight sensation, and there is no such thing as overnight. And I've never seen a vaccine that has been developed that quickly. And that's because of the science of vaccinology in itself, whether you have to determine whether the patients are, how much immune response there is to that vaccine, and whether one vaccine alone is enough to give you that antibody response and that protection for a certain period of time.
So could we have a vaccine by this year?
Nah, I don't think so. But that's a shot in the dark. And if we do get one, then that's luck.
Well, we're all hoping that we will find that vaccine and get that vaccine right here in the Philippines sooner rather than later. Dr. Benjamin Ko, an infectious disease expert, thank you so much for your insights.
Thank you.